Hi there, my name is Dr. Patrick Lynch, and I specialize in helping people completely recover from Lyme disease, co-infections, other opportunistic infections such as mold, parasitic infections, systemic infections, and chronic illness. So basically, any kind of chronic illness, autoimmune disease, and so forth, that's what I do. I help people recover from these things. This specialty was chosen for me, and it was chosen for me because this happened to me. I went through a very severe process of going downhill and almost losing my life to chronic illness, and I had to figure it out. So the cool thing is like many of you, I love to live. I love Mother Nature. I love the great outdoors. I love to feel healthy and feel good, and I love to live. And I have loved to live my whole adult life. Ever since my early 20s, I've became a health nut. Some of it was diet related, some of it was supplement related. There were practices such as the internal arts, external arts, etc. So at any rate, I got to the point to where I'm in my 30s and my health started to decline. I get into my 40s and my health not only was declining more, but my body was shutting down on me. And I'm like, wait a minute, what's going on here? I'm a I'm a health nut. I eat well, I take care of myself. I do yoga, I meditate, I practice martial arts. I'm fit and my health is declining. And I was just like, this is extremely weird. I'm the last person that should have a decline in health. What is going on? While I was in my medical program, my body shut down on me and I was hospitalized 4 times in 4 months, almost losing my life each time. Doctors wanted to diagnose me with Crohn's and MS. And I asked them, I said, well, what's the what's the cause of Crohn's? What's the cause of an MS? And they said, Mr. Lynch, we're sorry to say, but there is no known cause. And I'm like, really? There's no known cause. And they said no. And as a matter of fact, you're probably going to be on hardcore medications and you might need some surgical procedures to help manage your life. And you're going to have to slow down. You might not be able to finish your education and you are going to have to learn how to live differently. You're not going to be able to do the things that you have done. And I was like, okay, this is not okay. And I'm not going to, I'm not going to go there. I hear you. I will remember what you tell me for the rest of my life, but I'm going to figure this out. I didn't tell them this, but that's exactly what I was thinking while I was laying there in my hospital bed, all cleaned up, shaved, in my civvies, hair washed, combed back, ready to get out there. Even though I couldn't walk any more than 20 feet at a time, I couldn't carry on a conversation without remembering what I was talking about. I had severe dizziness, vertigo, difficulty swallowing, heart pains, intermittent episodes of tachycardia, severe back pain. I had drenching night sweats. It felt like I had electrical, like zap sensations throughout my body all the time, severe abdominal issues, numbness and tingling in the extremities everywhere. I had skin presentations, chronic sinusitis, you name it. I had an abundance of symptoms that were severe, and I didn't know why. And doctors had no explanation. One thing I did have was I had the willpower to figure it out because I wanted to live. I had a family. I had a son who was 8 years old or so at the time, and I needed to be there to raise him. And like I said, I love to live. I could not imagine not being able to get back on my snowboard, not being able to get back on my mountain bike, and not being able to enjoy the great outdoors any longer. And so I set out after my last hospital visit, and I knew basically how to stay out of the hospital, but I didn't know why I had to not do those things in order to stay out of the hospital. And so I did. And meanwhile, from about April 2016 until February of 2017, I set out on this mission to figure out what was going on with me. I saw about 20 different specialists and doctors and healers and who knows, all kinds of people trying to figure out the cause of my illness. And I might have gotten a tiny bit better around December, January. I could walk maybe 100 yards, but I still was extremely compromised. I was still in my medical program at the time. I would go to school, I would do my thing, would leave school when I was done. I had no social life. I was just hanging on, hanging on for dear life. I had a family and I needed to basically just hone in and figure out what was going on. Come around February of 2017, I take this class. I take this class that was part of my program, and it was on Lyme disease, autoimmune disease, and the causes of chronic illness. And so I'm in this class, and every day light bulbs are going off in my head. Things are ringing true. And not only that, but it's like everything seems to be coming to a head. My wife is telling me, hey, I feel like you're going to figure this out. I have friends who are in the same boat as me, who have diagnosis of like MS, Crohn's disease, Lyme disease, mold infections. And in this class, I'm learning the cause of disease, the cause of chronic illness, the causes of autoimmune disease, the causes of cancer. And I'm like, okay, finally, after 2 weeks, it was around February, middle of February sometime. And I come home one day and I'm like, babe, I figured out what's going on with me. And she's like, well, what's that? And I said, I have chronic infections. And she's like, oh, okay, well, what are you going to do about that? I'm like, don't worry about it. I got this. And it took me from the middle of February. And granted, this class was about learning about chronic infections. And it was about learning how chronic infections present in the body and how different chronic infections present in the body. And when we get to a tipping point in our pathogenic load, how it can trigger our weak genes and how the elevated pathogenic load can also somatically change certain genes. So I set out on this from February of 2017 until October 2017. That was my healing journey. That's how long it took me to overcome all my chronic infections. So I had a friend who was in my class. She was a naturopathic doctor at the time. And I asked her, I'm like, hey, will you give me a Lyme disease test? And she's like, yeah, sure, no problem. And I said, okay. I was like, it doesn't matter if I test negative for it. It doesn't mean that I don't have it. It doesn't mean that I don't have another chronic infection. It could shed some light. And she's like, yeah, that's exactly right. And so I took the test. The test for Lyme disease was a negative. I didn't take any other tests for any other microbe, and it didn't matter to me. So I realized that whether I tested positive for a specific microbe or not, it doesn't mean that that was the dominant infection that's causing the chronic symptoms in my body. It just meant that I carried that microbe. So, what sense did it make for me to go down the road and do all this different types of testing? What mattered to me was to figure out how to go after all categories of microbes in the body, bad microbes, that is. And so I realized there's got to be billions of different pathogens in the world. There's got to be billions of different types of bacterias, parasites, protozoas, viruses, malarial type of infections, yeast, fungus, and molds, and so forth. And so I was like, well, how do I go after all pathogens if I don't know which one I have? And so then I narrowed it down to categories. So I was like, okay, I'll just narrow it down to 7 categories of pathogens, and then I will figure out how to go do it from there. And so I knew that there was not going to be a doctor that could help me eradicate my chronic infections. It just is not a thing to hear of doctors eradicating chronic infections, especially chronic infections that people have had for a long time. And so I was just like, I'm going to do this myself. And I did. And I figured it out. And so after I figured it out, I got my life back. And in fact, I got my life back before I was done. I went from not being able to walk. This is how a lot of people's process looks. After 1 month, for people who are debilitated, including myself, they might feel a little bit better, but they're not really sure. Some people feel a lot better, but it's rare. But for people who have chronic illness with a high pathogenic load and a lot of severe symptoms, after 1 month of treatment, they don't really feel much better. But on paper, when they come in to visit 5 weeks after they begin treatment, they make improvements, but it doesn't feel like they do. After 2 months, they might feel a little bit better. And in fact, I felt a little bit better. And I realized I was doing the right thing. And I realized that it was going to take some time, but at least I wasn't going backwards and at least I wasn't remaining stagnant. And that happens with other people as well. After 2 months, they realize that something's happening. They feel better, but they're discouraged that it's not happening fast enough. And so you got to realize if you have chronic infections for decades, you got to realize that it's going to take some time here in order to feel better. You can't just feel like drastically better in a couple of months. I mean, maybe you can, but I haven't figured it out yet. Maybe I have figured it out and I had just haven't shared it. So at any rate, that's a different story. This is the path that I chose, and this is the route that I chose. And at 3 months, I felt much better. I joked around as if I was in remission. I wasn't. I was very compromised, but I felt a lot better, and a lot of my symptoms started to clear up. My dizziness was gone, my sinusitis was gone, my heart pains were gone. I had more energy. I was feeling quite a bit better. And this is across the board. Generally speaking, around the 15-week mark, people feel significantly better. At the 4 month mark, people have pretty significant Herx reactions. My approach is gentle, and I increase aggressiveness as the body tolerates increased aggressiveness. However, when you stop the motility of pathogens and when you don't feed pathogens for a long period of time, then at some point in time, the ones that aren't fed and the ones that can't be motile, they all die off in big numbers after a certain amount of time. And when that happens, people have a Herx reaction. After that Herxheimer passes, people feel quite a bit better. Around month 5, I start exercising again. And that's when other people who were at one time debilitated, that's when they start exercising again too. People start exercising around month 5, but it's gentle. People aren't torquing on the body. They're not going out and running marathons. I've been an athlete my whole adult life and on my youth as well. However, with chronic illness, when I got to the point where I was debilitated, I had to start slow. And even though I had this muscle memory, my body would not let me without having severe reactions. And so I would just get on my bike and I would just pedal around the neighborhood, super slow. By the end of month 5, I was pedaling into the next neighborhood and pedaling faster and riding up little hills. And month 6, I was mountain biking again. I was mountain biking on the mountain bike trails up around Mount Hood. And month 7, I was going on long mountain bike rides. I started jogging. Month 8, I was jogging, mountain biking. Basically, I was back. And month 8, I was done. I was damaged. I had some cartilage degeneration and some tendon degeneration. So my tendons were hurting when I would exercise. It took a good year for my body to regenerate. And there are certain things that I did to help the regeneration process. But after I was done eradicating my chronic infections, I went back to a normal diet. I went from killing bugs to doing things to help regenerate my body. Years later, I feel great. I haven't had any relapse. People who do my protocol don't relapse. And it usually takes anywhere between 10 months and a year. It just depends on the severity of the type of microbe that people have. I've had people with systemic chronic infections of many different kinds, including parasitic infections that have become systemic in the body and all different types of tissues of the body. To eradicate a parasitic infection that is systemic takes time. It's not difficult, but you got to be careful and you need to know what to do and how to do it and how to do it safely so you don't harm the person and so the person doesn't harm themselves. So, at any rate, that's a little bit about what I do. How did I figure all this out? I was in my master's program and I finished my treatment about 2 months into my doctorate program. After I started my doctorate program, we were asked to pick a thesis to write on and to research. And I was just like, man, I was so far done with my experience with chronic illness, Lyme disease, co-infections, autoimmune disease, that whole thing. I was just like, I was pissed. I was pissed that I lost that much time of life. I was pissed at the medical system. And I was just angry. And I was just like, I don't even want to think about this. And so probably 6 months down the road, in my doctorate medical program, I was thinking to myself, I know I have to do this, and I know I have to do my thesis on this. And so I changed my thesis from what I originally chose to this topic, and this topic is how to clinically identify the root causes of chronic illness and how to effectively help people get their lives back with Chinese medicine. And it ended up being, it's not just Chinese medicine, but there's other things involved. I call it complete medicine. So there's things that are involved that are needed to help people with chronic illness get their life back. And so I researched the cause of disease, and I backed up all my theories through research from the medical databases. An elevated pathogenic load causes disease across the board. So there's lots of things to know about pathogenic load can increase over time. However, we're not going to talk about that here, but we'll talk about that in other podcasts. So I set out to do my thesis and figure out the cause of disease. I honed it into environmental toxicity as well as an elevated pathogenic load. Okay, so how to effectively help people recover from chronic illness and autoimmune disease. So basically, we need to clean out the body. And we need to clean out the body utilizing a certain procedure. And this is what I call complete medicine. So this takes into account meeting, connecting, and listening to people. When people come see me for the first time, they are in a very hard place. They are far down the road. They've seen many doctors and they come to me as a means of trying what I have out as their last hope. And I wish I was their first hope, but a lot of times, if people come too early, they're not sick enough in order to do the treatment that's necessary and needed in order to help people get their life back. And so meeting and connecting and listening to people need to be heard. And so I don't have people fill out this 10 sheets of medical information about check these 100 different symptoms if you have these. I want people to tell me, hey, I got like tremors when I hold my hand out in front of me, or I have this burning pain in my flanks, or I have dizziness and vertigo. People need to be heard. Not just write it down on a piece of paper and then go see a doctor for 15 minutes and say, oh, you have Parkinson's. You're going to be on immune suppressants for the rest of your life. Oh, what causes it? Oh, we don't know, but here's your medication. See ya. I want to hear what is going on with people. And then after I hear what's going on with people, then I go down my own list of symptoms and I ask people if they have more things going on specifically. And every single time they do, people have about at least twice the amount of symptoms than they report. They just don't think about it because there's so many. And so then I have this big list of symptoms of different severities. In regards to diagnostic procedures, that's really important in order to understand what's going on with somebody. You have to know their symptom presentation. And so proper diagnostic procedures incorporates understanding their symptoms, why they have their symptoms, how long they've had their symptoms, and then I'll do a demographic check. Throughout their life, I will want to know where they lived, and I will want to know the integrity of their home. I want to know when they started getting sick. I'll want to know certain aspects about their health throughout their life. Did they travel? Did they get sick when they travel? How long were they sick for? Treatment incorporates proper diagnostic procedures, detoxification, stress management, dietary modifications, a system of cleaning out the body of all categories of pathogens and toxins and environmental toxicity, regeneration and prevention and education. So, learning, connecting, and listening to the person. They feel heard. You connect with the individual. A doctor needs to do this. People need their doctor to do this. Personalized genomic medicine is not going to do this. They go in and they have some AI program tell them what's wrong with them and then advise what medication they need. No, that's not going to get them back to health. People need another human to hear them, understand them, empathize, have compassion, and then devise a practical, safe, and effective system to help them feel better. Detoxification. What does that look like? So we need to open up the detox pathways first before we start killing bugs, before we start implementing antimicrobials. Stress management. Stress management, it's very important to learn how to manage mental stress, emotional stress, physical stress, and environmental stress. Stress management needs to be done because when people have excess stress in one of those four stressors, then what happens is the immune system weakens. And when the immune system weakens, then the pathogen will increase motility. And when the pathogen increases motility, then when the immune system turns back on, we have increased immune reactions due to the increased pathogenic motility. So symptoms get worse. People will have a flare, and people will have flares when they eat something they shouldn't, when they stress out about something mentally or emotionally, or when they're exposed to some kind of environmental toxin, or if they have exercise sensitivity and they move their body too much. So stress management is key. Dietary modifications are key. That's what kept me out of the hospital. That and not using my body. So dietary modifications and the right dietary modifications are essential for helping people return to health from having chronic illness. Are they essential for people to practice for the rest of their life? No. Are they essential for people to get it done and get their life back? Absolutely. And so basically what it's about is it's about not feeding the bugs. You don't want to feed malarial type of infections, bacteria, widespread bacteria, protozoa, parasites, viruses, yeast, fungus, and mold. So you have to know what feeds them, food-wise and supplement-wise. People take all these supplements that their doctors recommend to take for this, that, or the other thing that feed the infections. And they just chase their tail for the rest of their life while their symptoms get worse and then they die. So it's very important to modify diet, modify your supplement regimen correctly. And then it's about killing bugs, going after all categories of microbes. So when people start the process and they've been sick for decades, you got to go gentle. You got to go really, really gentle. Otherwise, you can put people in bed for a week or two at a time, vomiting every day, having diarrhea, all the things. And so you have to open up the detox pathways, not feed the bugs for a while, then start killing off the infection carefully. Throughout time, when the body presents as if you can pick up aggressiveness, then we go deeper and we continue to go deeper into the body, rooting out all categories of infections until you're done. Then we discuss regeneration and prevention. How can people prevent this from happening again? This is really important. And the main thing about disease prevention that you don't hear from anybody is keeping your bugs under control. There are ways to do that. If people utilize the proper methods of prevention, then they can live a long, happy, healthy life without having disease and basically feeling good. There's an Italian province, I think it's in the Mediterranean somewhere or something like that. I don't know if it's an Italian province or somewhere in the Mediterranean. I don't know if it's an island or if it's on the mainland over there, but I do know that there's a community where people live well past their hundreds. All their dogs and cats live into their late 20s and into their 30s. And I've seen videos of dogs running around chasing their ball at 29 years old without issues. They don't look old. They're a little bit slower, but they're happy. They have a smile on their face. They don't have arthritis-like issues, and they're feeling good. And the key thing that they do over there is they keep their microbes under control in their body. They give their dogs and cats herbs every day, and they make it so it tastes good. I don't know what they do, but that's the main thing that they do. So regeneration, we need to regenerate the body after the chronic infection has done the damage. That takes time. That could take a year. That could take a year to get the majority of the work done. And then from then on, you have a new lease on life. You get stronger every year. You feel better every year. Your immune system is working well. Everything's working better. And it's awesome.